I'm Narda. I live in Ontario, Canada. I'm a mother of two, and I was diagnosed with breast cancer in 2011. At that stage, it was a stage 2 cancer. I did a double mastectomy. I did 6 rounds of chemo, and then I was good for almost 5 years. In the fall of 2015, I had a little reoccurrence, after which we did radiation. And then in the spring of 2017, I was diagnosed with metastatic breast cancer with metastasis on my liver. I tried 3 different kinds of chemotherapies over the span of the summer. None of the chemos were working for me. My cancer kept on getting worse. My tumor almost doubled in size. I was living on IV. And at that stage, they set me up with palliative care and told me that there was nothing left to do in Canada. My naturopathic oncologist told me about this clinic in Germany where I could go and get regional chemotherapy. And so when we got to this point where there was nothing left for me to do and I had weeks left to live, we started looking into this, and we had lots of support from friends to help us to make this possible. And then we reached out to Dr. Agner at Medias Klinikum in Germany.
Now, when I first read her reports, I've been thinking, when we discussed in our group, what should we do? Shall we accept her or not? Because nobody likes to treat a very advanced patient and then the therapy fails. Yeah. But this is why I wrote, hurry up. If you want to have a therapy, come quickly. Your liver is so large and you are close to liver failure or to jaundice. Yeah. And when patients develop jaundice and the bilirubin amounts up to 38, 39, 40, they die.
But as we've learned is that breast cancer is one of the very successful cancers that they can treat very successfully in the clinic in Germany. And immediately I started having great results. Right away after the first round of treatment, I was able to walk a little bit further. I was able to drink and eat, and I felt much better just after the first week.
It happens sometimes that we treat a cancer and it does not work, but about 80% really respond according to our expectations, and we know which type of cancer in which stage is most likely to respond in such a percentage and what is the life expectancy. We never say to patients that they will be cured, because you never know. For example, in breast cancer, patients can be in a complete remission and they survive 5 years, 10 years, 15 years, and suddenly they have a relapse. With other cancers too, but in breast cancer, especially in breast cancer, you never know, but also a relapse can be treated.
So the treatment I received in Germany at the Medias Klinikum is called regional chemotherapy. And what regional chemotherapy is that it's chemo that goes directly into the area where your cancer is. And Dr. Agner has been doing this treatment for 35 years. So it's not an experimental treatment.
If a patient or if a tumor does not respond to systemic chemotherapy, which means you inject the chemotherapy into the vein, it is diluted in 5 or 6 or 7 liters of blood, arriving at the target. This is why in many cases it does not work, although with a higher concentration it would work. And this is why we inject the chemotherapy directly to the tumor, into the tumor supplying artery, or the artery that supplies an area, which means the primary tumor and lymph node metastasis or segments of the body can be treated with our isolation perfusion techniques, which we can apply everywhere.
I've had wonderful success with this treatment in Germany. When I first went, my tumor marker was close to 1,000, and the last time when I went back, before I started my last round of chemotherapy, my tumor marker went down to 37, which is normal. It probably went down even more because I've done another round of treatment after those results. And also the last PET scan I had before my last round of treatment showed that there was minimal signs of disease on my liver. I feel great, I feel normal, I have no other signs or symptoms of anything, and I am very, very thankful that I've done this treatment.
Most important is quality of life, and if we can prolong life at a good quality, then we reached what we wanted, yeah, what we are aiming at.
So for anybody out there with cancer, I really recommend that you get in contact with the clinic, and I really want to stress to you that you should do it now. Don't wait, don't waste time, because sometimes the sooner you go, the better the results. And also sometimes if you wait too long, it will get to a point where it's too late. So please, I really recommend that you will contact the clinic and get some information and talk to them.